Why the black background? Nah, it's not like Korishabumi wants to perform or something like that.
Now you sabi.
All right, people. So let's get started. So our Zoom session for today is going to be on mental health. So we are going to shortly have an address or a welcome note from our chairman before we introduce our guest of the day. So, Mr. Chairman, over to you.
Good evening, good morning, good afternoon, everyone, wherever you're dialing in from. Thank you so much for joining this session. I mean, it goes without saying, mental health issues are becoming the fore. I mean, there's so much going on personally, worldwide, and a lot of us come from a generation where it was never talked about. So, they tell you as a man, be a man. As a woman, well, these things happen. It's a man's world. And then we go through life with so many repressed feelings, repressed emotions. And when something does happen and you lash out, they say, "Oh, what's going on? Why are you reacting like this?" So this is something that I feel not only is important, but is necessary for everybody. Please, I encourage everyone here to not only listen, pay attention, and ask questions, but even come back to this video, the recording, watch it again, take notes, and practically apply some of these lessons that we'll learn today in your day-to-day life. Thank you very much for joining. It's a Saturday. We should be with our family, so we'll make it as short as possible. Thank you very much. Over to you, Oluwakemi. Thank you.
All right, nice one, Mr. Chairman. So we are going to have a brief on mental health by Dr. Shola Yunus, our welfare secretary. So over to you, Dr. Shola. Dr. Shola, can you hear me? I think Dr. Shola exited briefly. She will come back. So let's just go.
Probably network.
Probably network, yes. Introduction is important. A techie like me can do no justice. Okay. Dr. Yunus, unmute your mic, please. Okay. So over to you, Dr. Yunus. A brief on mental health generally.
Okay. Hello everyone. Thanks for joining in for the maiden health talk for our class alumni. So more than ever before, it has become quite necessary, to beam the spotlight on mental health, importance of well-being, and generally. In recent times, the rate of suicide rate, the rate of people coming down with depression and other mental, illnesses or disorders is becoming quite alarming. And especially in a society as ours, where people still hold on to certain beliefs, certain myths, certain traditions, they automatically interpret this to mean that, oh, if someone is going through mental, they interpret it to mean that a mental challenge, is as saying that you have a mental disorder, which is not the case. However, we thankfully, people are now starting to realize the importance of paying more attention to their mental health, their mental wellness, their mental well-being. And, you have a lot of advocacy coming up as to advising people on seeking, mental health when necessary, or mental help rather when necessary, and for some people, they might be going through some stuff, they don't know how to share with others and all that. And part of the reason might be because, they feel, they might be stigmatized, they might be made fun of. Some might even be bullied as a result of what they are going through. So generally, because of the rising rate of mental health illnesses, rising rate of suicide, rising rate of mental illnesses from substance abuse, we thought it necessary, to fashion the theme of this first health talk after mental wellness and well-being. And thankfully, we have a speaker today who is going to do a lot of justice, to the topic. And I will use this opportunity to appreciate her for, accepting to enlighten us and educate us, further on these issues. I say thank you to us all, for those of us who are present, and for those who will still be joining us. I welcome us all to this inaugural health talk for the FEGO 2000 class alumni. Thank you.
All right, thank you, Dr. Olushola Yunus. So I'm going to introduce our guest of the day. She's based in the United Kingdom. Her name is Dr. Oluwakemi Bamidele. She's a member of the West African College of Physicians and the Royal College of Psychiatrists, United Kingdom. So over to you, Dr. Bamidele. You're welcome.
Thank you. Thank you to the ESCOs of the FEGO alumni group for this privilege to speak on this forum. I'm happy that mental health is garnering, some sort of exposure, and it's a privilege to, talk about mental well-being, as well as, talking briefly on dealing with bereavement. Now, like Dr. Olushola rightly said, the burden of mental health is quite high, especially in recent times. And the recent report about 3 years ago made by the Global Burden of Disease Association stated that mental disorders are among the top 10 leading causes of burden worldwide. And it's also very concerning that depression is now the second leading cause of disability worldwide, which it majorly contributes to suicide. And recently, a year ago, the World Health Organization reported that every 40 seconds, one person dies from suicide. You can see that it's really quite alarming. And a report also has revealed that about 50 million Nigerians are suffering from one sort of mental illness or the other, which is really alarming. And recent reports also from the WHO has said that 1 in 4 individuals would have a form of mental health illness at one time or the other in their lifetime. So it goes to show that we need to make mental health care a priority. Yeah. So this begs the question, why exactly is the burden of mental health high? So many things have contributed to the high burden of mental health issues. One of them, as Dr. Shola has mentioned, is the fact that our beliefs, especially in sub-Saharan Africa, and our perception of mental health problems has actually affected the way we seek help. Most of the time, most people attribute mental health conditions to the work of village people, witchcraft. And as a result of that, they would rather seek traditional health care rather than going to the hospital. As a result of that, it really leads to, the high prevalence of mental health disorders. Another thing is the lack of health personnel. The normal report is that for Nigerians, we have one psychiatrist to about 1 million people. So in a population of 1 million individuals, we just have a psychiatrist present to treat that large mass of people. And with the recent Japa syndrome that is happening, most of the health workers have left. We had a total of about 300 psychiatrists in Nigeria. Now the figures are saying that we have less than 150 psychiatrists in Nigeria.
Wow.
So you can imagine that the burden of mental health problems will be quite high, especially in Nigeria. And then unfortunately, we have the issue of most of our mental health care facilities being centralized in the urban regions. Most of the primary health care centers in the villages, the rural areas, they don't have any form of care. They rather go and see Baba Sadiat than, come to the urban setting to get treatment. Another issue is the fact that COVID pandemic has really wreaked havoc on almost everybody. I would say that at least 95% of individuals have suffered the aftermath of COVID pandemic in one way or the other. It could be in terms of your finances, it could be in terms of your health. And following the COVID pandemic, even during the COVID pandemic, out of 9 patients, maybe new cases we see daily, 4 of the patients were having anxiety disorders. They had not had any previous history of mental health challenges. But as a result of, the anxiety, they started coming up with psychological problems. I myself, I had some form of anxiety because I was so worried about if I had contracted it, I would wash my hands, do so many sanitary measures before I even step into the house. Even the problem, I had issues with even trying to hug my children because I felt I was going to pass on to it. So in one way or the other, COVID pandemic has really, really, really done a lot on individuals. And then we have the economic downfall. So many people are really, really, bothered about what their next source of income will be. As a result of that, they've come down with so many psychological problems. And then we live in the digital age. Social media, yes, it has its own advantages, but I must say that it has also, has had its own demerits. We are so obsessed with how this one has attained something, how this one has not attained something. And as a result of that, some people have been dealing with so many self-esteem issues, and many people have gone into having some form of anxiety disorder, some form of depressive disorder. So that's also contributing to the high burden of mental health challenges. And with the advent of wars, the Ukraine war, the Boko Haram, so many, conflicts here and there, we've had issues with increments in, mental health challenges. Yeah. So now we have we have common misconceptions about mental health problems. Now this is a pictorial representation of how we actually, most of us, a large number of us view people who have mental health challenges or psychological problems. We may just have some mild psychological problems like anxiety, and the next thing, once you confide in someone, this is the image that comes to most people's mind, that, most likely this person is going to end up like this Mr. XY in this picture. So what are the common misconceptions? Most people believe that those who have mental disorders, there's no hope for them. It's like a death sentence. Once they hear that this person was diagnosed with so mental disorder, the family members start saying, hey, there's no hope. Another misconception is that people who have mental health conditions are violent. That's just an erroneous belief that has been, propagated by the media, especially in Nollywood. Once somebody has a form of mental breakdown, the next thing is they assume the person will run down the street and strip he or himself or herself naked, which is a very wrong misconception. Yeah, so the most popular one for the causes of mental health disorder is that mental health disorders are caused by, witchcraft, or maybe there's ancestral curses, or he had offended some people in the village, and then that was why he came down with any form of psychological problem. That's a very wrong misconception. And then, there's this common belief that when we see, especially on social media, you see an old person, confessing that she committed, she killed her son's child, or she was responsible for the misfortunes of her neighbors, and the next thing people assume is that she's a witch. This is very wrong, because it's a very common symptom in individuals who have dementia. Very common. Old people that have dementia usually confess to absurd things. They have this guilt, and their memory is so impaired that they would just, confess to negative things. And usually they are the ones that we see, and then most people stone them or do jungle justice to them. Yeah, and also another thing is that people who also indulge in this type of confession, they may have been suffering from severe depression. People who have severe depression usually have such intense guilty feelings that whatsoever negative thing, any bad thing that has happened, they would attribute it to them doing that. So that's a very wrong misconception. Another misconception is that suicide, anybody who had committed suicide was probably depressed. If you notice on social media, the next thing they'll put is hashtag say no to depression. Depression is real. It's actually wrong. Yes, we know that depression, yes, is a major contributor to suicide, yes, but it could also be as a result of other psychological problems. People who have psychosis may be hearing voices that are commanding them to actually end their lives. Very distressing symptom for people who have psychosis. So that's something, that's a myth that we need to debunk. And then lastly, here is that depression is more acceptable than psychosis. Most people say, oh, she has depression. I have depression. I was depressed. It's a very wrong notion, a perception that, yeah, I think it's the society accepts it more than psychosis. In fact, depression is the prognosis in terms of like the complications attached to depression is actually quite high. So there's no more acceptable, there's no disorder that is more acceptable than the other. Yeah. So yes, we know that there are, like I said, there are certain factors that have made the burden of mental health disorders quite high. But you notice that despite all these, unsavory things happening, some people actually do not come down with mental health challenges, while others will have it. So, what actually makes an individual more vulnerable compared to the other person? And these are the factors that may actually predispose individuals to mental health problems. And now the first most important factor is the biological risk factor. What I mean is basically is that there are some people who have had family history of mental health problems, and they're usually more predisposed to it. That doesn't mean that if your father has a mental health problem, you would have it. But there's a certainty that along the lineage, there will be someone who would inherit that gene. Another thing is personality traits. Individuals who are found to be more anxious, there are some people that they are just basically warriors. They tend to worry for no reason. You will just be wondering that why do you worry a lot? That is just the personality trait they have. Usually they are more predisposed to having anxiety disorders. And then people who have this perfectionistic trait, you want everything to be perfect, everything must be in a certain way, you're a very neat person, you are very into details. Usually they tend to have some form of mood disorders or the other compared to other individuals. And then the environment also plays a lot of factors. We have now there's a high rise in the availability of substances, psychoactive substance. Here and there you see it readily available. Cannabis is like pure water. You can't walk from one place to the other without you seeing somebody selling cannabis. Tobacco, very readily available. Alcohol is even accepted in certain culture and society. So it's readily available. So substance abuse, unfortunately, has predisposed people to mental health disorders. I'll talk about that later. And then we have adverse life events. Some people have been dealt back to back with so many misfortunes, loss of parents, loss of siblings, so many loss, and it could predispose people to having some form of psychological problem or the other. And then we also have the economic challenges, like I said earlier, and then the social factor. And as we are now in the Japa wave, where everybody's trying to, migrate and all that, it's been found that people who have migrated to other countries have some form of challenges health-wise. In fact, there was a recent report from the general practitioners that they noticed that most people who came into the UK were coming down with some form of depressive illness, anxiety disorders, because your expectations may not be what your reality is now. You had so many lofty dreams of how this place would be, and then you come and then you are shocked. And then the change of the family dynamics. You are no longer probably the breadwinner. Maybe it's your wife that is earning more. It tends to take a toll on your mental health. So it could be a predisposition to having some form of psychological issues. Now, in as much as I've mentioned factors that can make an individual vulnerable, we also have protective factors. So individuals who are resilient, they from one challenge to another, they are able to succumb. They're just resilient by nature. They are usually more protected from mental health problems. And then having a good social support, that support system is very key. It's a very protective factor for people against having psychological issues. And then good educational background. The fact that you are exposed, you are enlightened, that you should actually seek mental health care when you feel you are stressed, or you are knowledgeable about the warning symptoms of a psychological breakdown, makes you seek help on time without it getting worse. So those are protective factors for people. Yeah. So we have common presentations of psychological problems. The most common is actually poor sleep. Yeah. When you do not sleep adequately, it's a big issue. And it's something that you should actually not take lightly. That's even one of the warning signs for some of our patients that already have established psychological problems. Once they have that poor sleep, we tell them to come for treatment immediately. So poor sleep is the most common presentation for almost all psychological problems. Then we also have irritability. That's just undue readiness to just get angry. You notice that you get angry easily, which was not how you were before. That's a big issue. And then feelings of undue sadness. Just when I mean undue sadness, I mean sadness that there's no reason, even when there's something a positive thing happening around, you just find out that you are just sad. Nothing can even make you react positively. So that's what I mean by undue sadness, and that's common in depression. And then when you notice that you have lost interest in previously pleasurable activities, things that used to enjoy. You're a guy, you love watching Premiership, you love hanging out with your friends, and you would rather stay alone than go for that. That's a sign that there's an issue, and you should actually seek help. And then, reduced energy. You wake up in the morning and the will to even get up from the bed. When I say reduced energy, I don't mean that you don't play ball like before. You just do not want to get up from that bed. Your spouse or your friend tells you, "How fun, our guy, stand up. What's going on?" And you're like, "I don't just know. I can't even get up." And then you take like 5 hours doing a job that you usually could do for 30 minutes just because you are just slow. You cannot explain it, but you can't explain that internal tiredness. Those are signs that there's a problem. And then when you notice that you are talking to yourself, and then people ask you what's going on, who is around you, and you say no, then you keep giving excuses. No, that I'm just, I just enjoy talking to myself. I'm just trying to clear my thoughts. Those are signs that there's an issue. And then when you notice that you rather just be alone, you just don't want to hang out with people, just want to keep to yourself. Let's hang out. No. Let's go to church. No. Let's, just want to keep to yourself. Those are common presentations of a psychological problem. And then having strange beliefs, that's what we call delusions. Beliefs that are not acceptable culturally or, in keeping with your educational background. For instance, there was a patient we saw who said that he believed that lions had eaten his heart, and he kept holding on to that belief. That's a delusion. That's a bizarre delusion. We had a patient who said that her intestines were rotting, and that's why she believes that she doesn't have any intestine. That's a funny belief. That's a delusion, and that is usually common in individuals who have depression. They feel that some of their body parts are not even existing. So those are bizarre delusions. We also have the beliefs that some will tell you that there was a particular patient we saw who believed that he was a king. He printed out his coronation details program on Punch, and then he also went to go and buy so many acres of land in a place and said he was going to develop that community and all that, and he had to come for admission because we knew this was somebody who was functioning. He's a very popular lawyer in Port Harcourt, someone functioning very well, and thankfully his family members knew that this is not how he is normally, and then we brought him for treatment and he's doing very well. So there's always, the earlier you identify some problems and you seek help, the better for you. Yeah, so just briefly, I'll just go through depression. Like I said, it's a mood disorder. It's actually commoner in females, and it's really a very common mental health problem now that we are dealing with. Usually, like I explained, we have the symptoms of sadness, loss of interest, reduced energy, and usually suicide may follow it, especially if the person is depressed. Excuse me. Yeah. So, how do you know that somebody is depressed? I've mentioned the symptoms, but usually it should last for at least 2 weeks. If it lasts for more than 2 weeks, then you can comfortably say most likely this is depression. And then we have different types: the mild, the moderate, the severe. So the severity now depends on if the patient, aside from all this sadness, reduced energy, and loss of interest, if the patient has additional symptoms like loss of reduced concentration, loss of appetite. Now, what we usually do is, for people who have depression, we usually admit, depending on the severity, and then the patient can benefit from medications as well as therapy. Now, most people will say that depression is caused by she lost somebody, she did this, she did that, maybe the husband dumped her. Yes, those are triggering factors that could have made her vulnerable for the mental disorder. However, it's actually caused by reduced level of a particular chemical in the brain that balances the mood. So it's not actually as a result of maybe those things. Those things triggered it, but the problem ab initio is the fact that the chemicals are reduced in the brain. And so what the medication does is that it will increase that level and balance it out. And then as well as having some form of talking therapy. So all those things help. Talking, changing the way you think and all that. Those are helpful for conditions like depression. Another condition that is very common is this anxiety disorder. Like I said, it's really on the increase. And we have so many forms of anxiety disorders. We have the obsessive compulsive disorder. Most people will say, I'm so OCD, I'm very OCD in the way I do my things. That's not, I get shocked when people use that word, because that's actually a serious disorder. So it's something that nobody should take lightly. And then we have phobias, and this has actually increased, especially after the COVID pandemic worldwide. There's a rise in anxiety disorder. And how does this manifest? Um, it could manifest in form, it manifests usually in form of this fearfulness. You can't explain why you are excessively fearful. Most of the time, it could be in general situations. That's for people who have generalized anxiety disorder. They just get scared for no reason. Unnecessary worrying thoughts keeps coming through their mind. Sometimes you just see them sweating. They'll tell you their chest is tight, their heart is just pounding, their mouth keeps getting dry. And if you've actually seen somebody who has this anxiety disorder, it's very debilitating. It makes you not function at all. In fact, you are like rendered useless, especially when you are having those bouts of anxiety. So yes, it could be genetic, but there are certain things that may have triggered it. So you need to know what actually triggered it and walk through it. It could be as a result of a trauma that may have happened. It could be as a result of maybe some underlying issues you're having in your family, maybe the relationship issues. And the major treatment for anxiety is actually therapy. It's not really medications. Medications are used for just a short term, just to calm you down, maybe help with your sleep. But basically you will benefit from by seeing a psychologist, where they will give you coping strategies to cope with that anxiety. It could be in form of self-affirmation, saying words that would help you through that particular crisis that you're having. It could even be distracting techniques, like some will tell you to put a rubber band in your hand and snap it consistently to bring you out of that fear. And then it could be in form of there's a talking therapy where you write out your thoughts when you had that anxiety, what was going through your mind, and then the therapist helps you walk through the anxiety. Unfortunately, the culture of seeking help is really low. We have psychologists actually who can help, but most people do not see this psychologist, and usually they're in teaching hospitals. The ones we see on social media are actually, most of them are not certified psychotherapy. So we need to be careful in seeking the right form of treatment for these issues. And then we have psychosis. That's like the most common one that is popular, the most common mental illness that people know, the one where people assume that you strip yourself naked and all that. But it's not usually so. It's actually the chronic ones that may strip themselves naked. Yeah, so it's as a result of a particular chemical that is low, that it's excessive in the brain. And what the medications does for psychosis is that it reduces that level and balances it out. And like I said, these are the symptoms I highlighted for people who have psychosis. They could be hearing voices, seeing things that others cannot see, talking to themselves. Some may not even take care of themselves. And then also, like I said, therapy also comes into play. So you can see that it's not by seeing our babalawos and all this traditional healthcare, because there's even one fun fact. Most of these herbalists and these babalawos actually come to see us in the hospitals, and ask for our medications like Lagatil. And then what they do is that they mix it into their ontu. That's for, I think, the Islamic clerics. They mix it there, pray into it, and then for the Christian, clerics, what they do is they put it inside the holy water, and then they give the patient, and then the patient now sleeps and is calm, and then they say, "Oh, it's working. Baba is doing well." So really, you cannot do away with seeking, orthodox care. Now, substance abuse, which is really a big issue now. It's so sad because in the report from 2 years ago, by the United Nations Office on Drug and Crime, noticed that 1 in 7 persons have used drugs within the last year, and 1 in 5 people who used in the last year are now suffering from one drug-related disorder. So you can see it's a big issue. In fact, that's an exaggeration. About 60% of the patients we see that are on admission when I was in University of Ilorin Teaching Hospital were from substance abuse. So it's really a big issue. And it's been reported that in the next 5 years, if we do not do something about it, it's literally half of the youth in Nigeria are going to come down with some form of psychiatric complication or the other. So some particular psychoactive substances have been associated with schizophrenia. That's a form of psychotic disorder, especially cannabis. In fact, cannabis has been shown to cause, anybody who uses cannabis is 6 times more likely to develop schizophrenia. So it's really a big issue. And what substance abuse does is that it rewires the brain. There's a chemical in the brain, that's the dopamine, that helps you, it's released when you are when you are having some form of pleasure, like eating, having sex, and all that. So what psychoactive substance does is that, substance abuse basically is that it will now rewire the brain. The way the brain craves for food and sex is the way the brain will now be craving for this substance abuse, as in these substances. So you find out that most times people who are abusing substances do not eat like before. They will rather go and go after this substance than taking care of themselves, because the brain has been rewired and it keeps demanding for that. In fact, let's say the chemical released from sex is like, say let's say 40%. When somebody who is abusing substance takes any form of the psychoactive substance, the pleasure that is released is like by 150%. So you can see that the brain has totally been rewired. And unfortunately, one of the common complications of substance abuse is that it causes something called amotivational syndrome. You just don't have the willingness to do anything. You don't have motivation. You are just aimless. You don't have focus, especially with cannabis. Studies have shown that cannabis is particularly linked with this particular syndrome. So, like I said, it leads to depression, schizophrenia, anxiety disorders, memory problems, dementia, seizures. So we have so many, especially the young people on admission. We have 16-year-old, 17-year-old people who started taking substance. There was a sad case of a 16-year-old girl who just started, she was in 100 level, and she started taking substance by eating beans prepared by her roommates. They would always put cannabis inside the beans. And then, unfortunately, it's not everybody who comes down with psychiatric disorders. Some will use it for many years and would not have anything. Like how people always use Obama, that Obama took pot now. Why doesn't he have psychiatric problems? But unfortunately for her, she was more predisposed to being vulnerable, and she broke down by having schizophrenia, and we've not even still been able to bring her back to how she was before. So we really need to sensitize the youth about this substance abuse. It is really bad. In fact, most people now, when they don't even see substances, especially those that are on in secluded places, what they do is that they boil their sanitary pads, keep it inside the tin and let it ferment, and then they start inhaling it. So it's really a big issue. And then for you to know if an individual is dependent of active substances, you will find out that that individual has the problem of trying to cut down on that substance. He has made attempts to say, okay, today I'm just going to take 1 wrap instead of 6 wraps. And he ends up not even cutting down on it. That shows that that's a criteria that he's dependent. Another thing is that you find out that no other thing is pleasurable aside from taking this substance. You start shanking, forfeiting other activities, and rather focus on taking this substance. And then you can't control your intake. You say, oh, I'm going to take 2 wraps. And then you find out that you've even taken 15 wraps. So you have problems in controlling the intake. And then you continue to use it despite the fact that you know that this thing can cause seizures, this thing can cause mental problems, but you keep using it. So those are the signs that you are dependent. And if you have at least 3 of those signs, you are dependent on substance use. So what are the strategies that we can use in, taking care of our mental health, as this is really a big issue now? So we need to adapt, helpful coping strategies. Are you someone who is kind of introverted? You don't really like to talk to people. You actually need to talk. You need to pen down your thoughts. If you do not want to, talk to people, you can actually get a journal and write out your thoughts. It's been found to be very helpful to prevent, it gives you an outlet to, ventilate your thoughts, and that's very helpful for your mental health. Also, involving yourself in meditation. For people who are easily stressed, it's been found that meditation helps. Some people do yoga. You could actually meditate, go to a quiet place, think of a positive thing that has happened, or think of a positive, spot that you can remember. Some would think of a bar beach, wherever you found yourself very, where you found peace in. Think about that place and, and ruminate, think of calm thoughts, think of, positive things. That's a form of meditation. You could actually exercise. Exercising has been found, to be very helpful. When you exercise, there's a release of chemicals that soothes your mind. People use it to even clear your thoughts. So at least exercising at least 3 times a week for, say, minimum of 30 minutes is fine. It's been shown to be very, very helpful in mental health care. I indulged in that during the COVID pandemic, and it really helped me a lot. And then, relaxation and breathing exercise. For people who have anxiety problems, it is very helpful. Usually, therapists will teach you, but basically what it involves is taking deep breaths, holding your breath in, and then releasing it after a few seconds. If you do that for at least a minute, you'll find out that you feel much better when you are panicking. It's been shown to be very helpful. And then the most important thing is seeking mental health care. I cannot emphasize this enough. There is no shame in seeking mental health care. Please, if you have any problems, you feel you are not sleeping well, or you find out that you have so many thoughts in your head, it's just overwhelming for you. You feel as if your head is about to explode. Seek a therapist. There's no shame. We have pastors that we are treating. We have popular governors that we are treating, and they're taking their medications. We have celebrities that have mental. Most of us, we've heard about Kanye West, who has bipolar. So there's no shame. We have so many people that, Einstein had a form of mental illness. So with too many people. So what is now the shame in seeking help? We have psychotherapists available who would help you with therapy sessions, counseling sessions, and then medications. Please, if there's anybody who is on medications, I implore you to use it, because it even increases your chances of stopping it sooner. Anybody who has had a form of mental illness, the first episode, usually we encourage the person to use it without stopping it for at least 2 years. So do not stop before the time your doctor stipulated for you. And please do not mix it with holy water or onto. You understand what I mean? And then also, if you stop your medications, the second time the person breaks down with a form of mental illness, you will use it for 5 years. That's the standard. And if after the second episode you break down because you are not using your medications, it is for life. So that is why we place a lot of importance in seeking healthcare on time and also in complying with your medications. However, there are some people who may have to use it for the rest of their life, irrespective. Even if they were compliant with their medications, they may still break down. So that's basically it. And for people who have substance abuse, you can as well seek help. We have drug rehabilitation centers around the country in Nigeria, preferably in teaching hospitals, and we also have private practices as well. And then we have some organizations that also help. We have the Acido Foundation, which is quite helpful for individuals with mental health, psychological problems. They have so many form of therapies they can give you. And we also have the Mentally Aware Nigeria initiative as well. So that's basically about the mental wellness. For bereavement, we all know that's a complex experience, and usually it's a period of mourning and grief. And it's very important to note that, you know, no, but everybody is different. The way I grieve is different from the way another person will grieve. So we have various stages of grief, and it's important to note that there's no sequence, there's no particular set way in which the stages of grief can play out. The normal sequence is that usually when a person is grieving, the person will be shocked, in denial, and then the person starts getting angry about the situation. Person gets angry, is very bitter, may have outbursts of anger at anybody even trying to console him or her. And then the person now moves to, bargaining, telling God that, God, if I had done better, probably this person would still be here. Is it possible that you can still bring the person back? And then the person cycles through depression and then accepts eventually that the individual is gone. So it also plays out differently in children. The way adults grieve is different from the way children grieve. Children may come up with sleeping problems. They may be extra clingy. Some would even, start bedwetting, things that they had achieved before in terms of development, they tend to regress. So if you notice that the child who was already potty trained starts, bedwetting and all that, just know that it is the grieving process. And most likely, in normal cases, they get better. Yeah, so when a person is grieving, there are certain things you can actually do to help yourself overcome this grieving process. And like I said, relaxation techniques are really very helpful. So practice deep breathing regularly and then set realistic goals for yourself. You don't need to say, by next month, I'm going to overcome this grief. Just be realistic that it is a small step by step, you will overcome that grieving process. And then also ensure that sleep is important, because I told you that sleep is a medicine for the brain. So ensure that while you are grieving, yes, in as much as it's difficult, try and get more sleep, and then avoid taking substances to numb the pain. Now, how do you support somebody who is bereaved? As a friend, as a loved one, please try to listen. Do not shut them up. Let them ventilate. And then don't tell, especially the men. We know that our culture does not support men expressing suppressing their emotions. Please, if you want to cry, cry. If you want to go to your room and wail. Allow them, don't hush them. Offer practical help, be a source of support, help them remember dates of anniversaries. You can be there for them, anticipate that they may feel bad during that period and help them. And then you especially take care of yourself. And for children who are bereaved, we know that that's a very delicate time, and most children are usually abandoned during this period. So allow them ask questions, don't shut them up, and don't code depending on their age. For children who are above 10, they already understand the concept of death. So you can tell them gently that so person has gone, but the person is no longer suffering, is in a better place. And then let them know that it's not their fault, because most of the time they tend to internalize their pain and blame themselves that they were the ones that caused the death. And then also do not you compare them with the person that died, stating, oh, you look so much like that person. Maybe in your pain, you keep telling them that they may have that responsibility. They may put it upon themselves that they have to measure up to that person. So we have to be sensitive about that. And then don't overly depend on that child for emotional support, because they are children. They also need you. They also need to feel that comfort as well. And then it's important to note that you may need professional help. Normally, grief lasts at least for a year. We can't actually say when grief should end, but it could last for a year. Ideally, that's the normal process. But when the grief has not decreased in its intensity, after a year, you may need to seek for help. And then also, when you notice that this individual who is bereaved is not grieving after 1 year, 3 months, you don't seem to see the person, just seems to feel act perfectly fine. The person may be masking his grief, and it may be counterproductive. So that person may need to seek help. And then when you find out that you can't function, you can't carry out your normal activities, and you're entertaining thoughts of ending your life, please seek mental health care. And then for children as well, when you notice that the children are persistently anxious, they keep blaming themselves, and then they start becoming aggressive in school, and they don't want to make new friends or form new attachments, please let them see a mental health professional. It's very important. And some of the interventions for complications of bereavement include medications. Now, these medications are usually short term, especially for people who have some form of sleep problems or anxiety problems. So we usually give them for maybe 2 to 3 weeks, because there's every tendency that you may be dependent on those medications. So it's not something we give. But if this person now develops some form of depressive illness, the person may have to take some form of antidepressants. And then we also have a therapy we call grief focused therapy. We have specialists that are trained specifically in this form of therapy. They are professionals. They will help you ventilate your emotions. You would write down your thoughts, and they will help you help you handle each of the emotions you may be feeling from time to time. We also have family therapy for people who the grief has really fractured the family dynamics. It's very helpful. We have psychologists who are skilled in carrying it out. We even have psychiatrists that's actually their area of specialization. And most importantly, we have support groups. It may not be so common in Nigeria, but we have support groups in the developed countries. For countries like Nigeria, you could actually focus on support groups in churches, in the mosque, to help you through this pain. And lastly, it's important that you are kind to yourself. Please, let's be kind to ourselves. You deserve all the care in this world. Do not sideline yourself and focus on other people. Be kind to yourself. Thank you very much.
Thank you very much, Dr. Oluwakemi. That's been very comprehensive, very comprehensive. Before I push it over to participants to ask their question, if you would like to ask a question, just raise your hand. Check it under the menu. You can raise your hand so I call on you gradually. So please, everyone, let's try to be as brief as possible since this is the weekend. This is the weekend, and then even my generator fuel is going to run out soon. People complaining that I'm dark, you won't see anything again. Anyway, so thanks once again, Dr. Oluwakemi.
You're welcome.
So before I start admitting questions, I have a question, something I've always been confused with. Psychosis and schizophrenia. What's the difference between psychosis and schizophrenia?
Okay, so psychosis is actually an umbrella term for all the disorders. Do you understand? It's an umbrella term. It's an umbrella of disorders that affect your reality, the mind. There's a divide between the mind and the reality. Do you understand? So schizophrenia is a form of psychotic disorder.
Okay. One more from you. Participant.
Sorry?
Okay, Claire. It's a general term, I guess.
Yeah.
Psychosis. Okay. So we are going to take your question, Mr. Oladapo Kukoyi, our chairman. So unmute your mic and ask your question briefly.
Thank you, Dr. Kemi. It was a wonderful and very insightful session.
Yeah, thank you.
Coping mechanisms.
Yeah.
You mentioned it, and I've heard, and not just heard, I've even used it myself. I mean, there's this very popular song that is raining now, and there's a line in the song, I need to go and show you. Some people say alcohol is a coping mechanism. Some people say weed is a coping mechanism. And I have seen people who genuinely, they function. They go to work in the morning, they come back, they have a rough day, they light a blunt, they calm down, and everything is fine. What would you say about that?
Okay, so yeah, there's no harm in. I do not subscribe to abusing substance, you get, but there's a difference between recreational use and harmful use. So what you are doing basically is a recreational form that you come back from work, you take alcohol just to relax. It's different from when you are taking it despite the fact that it's already harming you physically. Do you understand? You're already having complications, like your judgment is affected, it's affecting your performance at work, your personal functioning. That is when we say you are abusing that substance. It's already, the pattern of use is already maladapted. It's affecting you. So it's okay for you to take alcohol. It's okay for you to take cannabis once in a while. But when the pattern of use is already detrimental to your physical health or your functioning, that is where it's an issue. So it's okay, but do not use it to numb pain, because there's every possibility that you are not fixing the underlying problem. You are just putting plaster on the wound, and it will keep festering. And the more it keeps festering, the more you may most likely get addicted to that substance use. So everything is about balance, but some people do not know how to strike a balance. And sorry, another thing is that if there's a pattern of addiction in the family, maybe Popsy takes a lot, there's every likelihood that it's hereditary. One person will be addicted. So if you know where you're coming from, you need to strike a balance. You get, so it's okay, but it should not just be maladapted the way you use it.
So, Mr. Adapo, I should be able to answer you, please.
Thank you very much, Doc. Thank you.
Okay. Bye-bye. So let's take a question from Adeyinka Adedigba. Please make it quick.
Good evening, Madam Dr. Kemi. This has been really, really insightful for me. And some of the things that you have said, to be honest, is kind of personal. If you have a green passport, I'm sure at some point in one's life you've been depressed. And this is me not trying to, undermine the depression that people have had in the past.
Yeah.
So I'm guilty of some of the things that you've said. When people say I'm depressed, oh, why the depression? I've had this, I've lost a job, I lost someone. Then I tell them, come on, that's a general problem. Everybody has had that, and people have come out of it. So I say that to people sometimes. Again, like I said, I'm guilty. How do you know when people are far gone off and they can't regulate? They can't come out of it. That's one question. And second question is, does tough love ever like get over it? You're not the first, you won't be the last. Like, get over it.
Yeah, so thank you for that question. That's a very valid question. Now, okay, let me just quickly address the second one. It is very counterproductive when you tell people to get over it. Your experience is your experience. Your experience is valid. So people trying to invalidate that, are you the only one that has gone through it? Everybody is different. Everybody's resilience factor is different. So I do not, it's very detrimental to people who are going through mental health challenges for people to tell you, can't you snap out of it? Of course they want to snap out of it, but they cannot. That's why they have this challenge. You get, so yeah, I do not subscribe to saying things like that. You don't just snap out of psychological problems. Now, to the question of depression, how do you know when this is quite severe? Is if I got you right? Yeah. So
Right.
yeah. So like I said, depression, we have different grades of depression. We have the mild. The mild usually, depression generally has a natural cause in the sense that within 6 to 12 months, it goes by itself, even when you do not treat it. But we do not advise you not to treat it because when it comes back again, it becomes worse. So that's the natural cause. Some people say, I didn't use any drug. I went to church, they prayed for me, and it got better. That's a lie. It's the natural cause. That's what happened. So it went away, but it will come back and it will come back worse. So for people who have mild depression, usually they just have like two symptoms, like they feel low mood, they are sad, and their energy levels is just low, but they can still function a bit. What we do for those people is that we do talking therapy for them, validation, change the way they think, and usually they get better from this form of counseling and talking therapy. Now, when it's getting to the moderate and severe depression, you most likely will need medications and therapy as well. Usually, you cannot function. You can't even go to work. You can't fake it. You won't be able to go to work. You're functioning with your family. People will know that there's a problem because you are withdrawn. You can't relate well. And at work, your productivity would really, really be bad. That's if you even go to work. Do you understand? And apart from the core symptoms of not having interest in pleasurable activities, reduced energy, and low mood, you will have additional symptoms added to it, like reduced concentration, your libido is low, you cannot sleep, and then when it is severe, you start having thoughts of, well, it's like I'm worthless, see myself compared to my others. What is the meaning of life? And then you can start Googling on Sniper, or you will just find out that you start taking more interest in people who ended their life, and then you start Googling, how fast can I end it? So once it gets to the moderate and severe, it's bad, and you need to seek help.
Okay.
So that's it, yeah.
All right. Yinka Deligba, I hope she has been able to answer your question.
I'm satisfied. Thank you so much.
That's right. Okay, thank you. All right, thanks, Dr. Oluwakemi. In the absence of any hand being raised up, I want to ask a question.
Okay.
Where do we cross the fine line between how can we have people with personality disorders? Most people have not been noticing that. I've been noticing that for years. Nigerians are not even aware of personality disorder. Me, I have a touchlight on all sorts. I meet all sorts. Psychopathic, sociopath, narcissists. A lot of them. So now, when we are speaking on mental health, the people with this personality disorder, which in my own research, I'm not a medical person, In my own personal observation, I noticed we are having it on the rise in Nigeria. So how do people with these personality disorders seek for help? Is it a long time? Is it a forever thing?
Yeah, so yeah, you're right. It's not that it's on the rise, there's just more awareness. Now, for you to say somebody has a personality disorder, it must have been something enduring. If you ask questions for that, you need to ask the relatives, friends, and has this person always been like that? And you cannot say somebody has a personality disorder until the person is above 18 years. It must have been long lasting. Yeah, so it's actually difficult to treat. Even here, it's a big issue. They have a personality disorder ward.
So we should japa when we see them. When we see
No,
the
not that you should japa. You should just have an awareness that that is how they are. And usually, there's no medication for it. Basically, what they do is they go for psychotherapy. So the psychotherapy helps them. Talking therapy and better ways in communicating with people and changing their mindsets, really. But it's very tough to treat. Yeah, so the awareness is, well, people don't really know about it
no,
actually, especially in Nigeria, and but it's difficult to treat.
we that we have to run businesses, we meet it every day with the
Yeah,
clients,
you
with the
meet them, but you
customers.
just knowing who they are, at least
No,
being aware of their characteristic traits, it won't shock you. Whatever they do, it won't shock you. You just know that
no,
not them.
at times it makes me angry. I must confess, it makes me angry.
Yeah.
Come down to,
Especially the people who have narcissists, personality.
yeah, you are reading my mind.
Yeah.
Come down to our office at Benin. Why? Why? I'm a remote worker. So why am I coming to
And
Benin?
OCD too could be very tough.
You
Those who
know,
have OCD, they are very difficult to live with.
serious difficulties are understatement. So does anyone else have a question? Just raise your hand.
Sorry?
For those that are new to Zoom, if you check your option, you see reactions, and then you see a button for raising hand. So let's
Sorry, did
just
you ask a question?
no, I didn't. I'm just asking people to raise their hand if they
Okay.
have any questions. So let's just wait a bit. At times it
Okay.
could be network. I'm not seeing any hands raised as that now. Okay, I can see a hand. Paul Uzochina, ask your question briefly. Unmute your mic, please, Paul.
Okay, it's okay. Come and sit. Come and watch it.
Hello, Paul. Unmute your mic. Paul, can you hear me? If you can hear me, unmute your mic, please. I think he's struggling with unmuting his mic. So you said something earlier about it being hereditary.
Yeah.
That's depression. Depression can be hereditary, right?
Yeah, most psychiatric illnesses are hereditary.
Most.
Yeah. But that doesn't mean that if it skips generations, except for twins. People who have twins and maybe the father has a mental illness, the twins, especially for schizophrenia, there's 50% chance of developing it.
Okay.
One out of the twin may develop it.
May develop it.
Yeah.
Paul, I got your message. You are saying the host isn't allowing unmuting. For every other person has been doing that. I'm guessing it's your network or something. You try raising your hand again so I can see you at the top. Let me see what I can do. Is that same? Is anyone having that same issue? Okay, let me.
Or maybe you could write it as a chat.
As a chat. Okay, ask your question as a chat. Paul, write your question as a chat. Anyone else that has a question should put it in the chat room. Paul, we are waiting for you. Or you can send it directly to my WhatsApp. Okay, I get his question here. So Paul is saying, what's the correlation between psychosis and the marketplace? He said, we usually hear people say you should not let psychotic people go near the market.
Actually, I've not heard of that. I'm sure it's a cultural belief. I've not heard of that.
I even think it's specifically a Yoruba belief.
Ah,
Yes,
really?
like Emadeko wọnú ọjà, tó bá wọnú ọjà, ó máa cast. I think that's the spiritual aspect they are saying.
I
I think
don't
that's the
know.
spiritual aspect they are saying.
We have so many misconceptions. They say there's Were Tutu, there's, I don't know, honestly. But too many misconceptions about
Does
mental
any
health.
other person have a question to ask? Anyone? Because if you leave me here with Dr. Me, I want to release the doctor. Because if you leave me and her, I will ask many deep questions and I'm not paying her for consultation. So that would be wrong.
Yeah.
I can see anything. Okay, someone says,
Hello.
Ewuyemi Oluwasomi says, thank you for this session. I have a young girl with a pillar disorder. I think it's bipolar disorder. She's actually a reserved child. What do you think we can do to help her? Bipolar.
Bipolar. It's confirmed the person has bipolar.
Is it confirmed the person has bipolar? She said yes.
Okay, so for how old is the person, please?
How old is she? 18 years.
18. Oh, she's an adult now. Also, for those kind of people, she needs to be very compliant with her medications because people who have had this kind of condition at a younger age, you need to be aggressive with her management so that the prognosis will not be bad. So she has to, you have to ensure that she's very compliant. You should watch out for warning symptoms that she's relapsing. Like for instance, if she's not sleeping well, she's becoming unduly angry, you notice that she's getting angry or she's restless. Those are warning symptoms. Please bring her to the hospital. But you have to ensure that she does not play with her medications. Another thing is that you need to be very careful with her interaction with the opposite sex because usually people when they have the manic episodes they may have poor judgment and they may be taken advantage of. So she has to be very careful. And then also substance. People who have this type of conditions, they cope by taking substance use because they found out that these substances help quieting the voices. If they are hearing voices, it's been shown to help them, especially tobacco. So you need to watch it, watch her, be very vigilant. But most importantly, show her love. She's okay. She's a human being. When she's stable, she's like any other person. So show her love, show her support, and don't treat her differently than the other children. And most importantly, avoid critical comments. It's been shown that when you are very critical with people who have these conditions, they tend to relapse more. Just treat her like how you treat her other siblings, and she'll be fine by God's grace.
Okay. So I guess she's been able to sort that. Do we have any questions before? I direct it to one of the members of the welfare committee. I guess she's okay with the response. Any other questions? If I may add, if there are further questions, you have to see Dr. Olushola Yunus so they can give you the Patreon or the PayPal or whatever account number. At this level, it has become professional consultation. At this particular level, with this much info, it has become professional consultation. Of course, I'll get a free 30-minute session.
Definitely.
All right. Thanks a lot, Dr. Oluwakemi.
You're welcome.
I'm going to call on Mrs. CG Ayon CG of the Welfare Committee to give us a vote of thanks. Unmute your mic, Mrs. CG, and unmute your camera too, if possible. Let's see your fresh face. Mrs. CG, can you hear me? I can see you. All right, we're waiting for Mrs. CG to unmute her mic. Why is it saying the host is not allowing participants? I didn't click on anything. Oh, okay. Let me check the setting. Okay. Okay, try it now. Oh, I'm guessing we might have more questions here. I'm seeing a question from Lekon Kolawole. Lekon Kolawole, can you unmute your mic? You unmuted your video, Lekon Kolawole. So it remains your mic. Okay. It's disabled. Is it enabled now? Please check it now. Please check it now.
Okay.
Better.
Thank you. Good evening. Olumide, nice to see you again.
Yeah, thanks.
And Dr. Kemi, thank you for that great session. Well, it's not a question I'm about to ask. I'm saying this for the benefit of everybody who has attended this seminar, and particularly for our colleague who just asked the question about her daughter or about a lady who has bipolar disorder, because so we can know that mental illness is not so far away. I myself, while I was in university in year 3, I had a diagnosis of bipolar disorder. Okay, and that was 2000 and what year was that? 2006. That was theory level. So just to let us know that it's not so far away and it's not beyond control. Up till now, I still take bipolar Epilim, which is a mood stabilizer, and I'm faithful to my medication, and I was able to graduate successfully, although I had 2 extra years in university, but what I can say is that I had a lot of family support. My family was behind me throughout the difficulties. I'm married now and I have a stable life. Thank God for that. So it's possible to have a normal life in spite of these problems. But the important thing is what Dr. Kemi said is important to be faithful to the medication. And the type of bipolar disorder is that usually we know when a problem is arising, when our mood is getting out of hand, we can pick it early. So when the child is detecting that something is about to go wrong, get the doctor quickly or psychiatrist, and get. I mean, you don't have to wait till you are out of hand before you check yourself into the hospital. Get psychiatrist. I'm not feeling very optimal, and then get yourself checked. So it's possible, to live a normal life in spite of bipolar disorder. And it's also helpful to let those around you, in church or your colleagues, to let them know that you have this challenge, so that if they notice something that you have not detected, they can let you know quickly that please, we need to get help. So I'll just like to say that for everybody's benefit. Thank you.
Thank you.
All right, thank you, Mr. Lekonkola. So does any other person have a question? Anybody? Mrs. CG, are you able to unmute your mic? Yes. I'm not. Why? Can you exit and come back, Mrs. CG? Briefly. Okay. Let's wait for her to exit and rejoin. So we'll leave our doctor. Okay. We're back. Okay.
Yeah, I'm fine now.
Yes, I guess it's a network thing or something.
Okay. So should I shoot?
Yes.
Okay, good evening, everyone. Sorry, I can't use video right now. Everywhere is dark. But don't worry, my face is still as it is. Good evening, everyone, once again. It's been a great experience having everyone around. Thank you so much for being able to attend this meeting, even out of our tight schedules, especially on an Owambe Saturday. Esheo, thank you. A big thank you to you all. I would like to say a very big thank you and a bigger appreciation to our invited guest, a professional of repute. We are grateful to have you, Ma, Dr. Oluwakemi Bamidele. Thank you so much for being in our midst. Thank you for dishing out notable and valid points. Thank you for all the misconceptions you've corrected, though. In fact, a whole lot of them. Thank you so much. I believe everyone also had great times, and we will go back with inestimable knowledge from here on. Eshe pupo, dalu, nagode. Cheers to everyone, and God bless.
All right, thank you, Susie. You're beginning to sound like a presenter of a TV show now. All right, thank you, Dr. Bamidele. It's been a wonderful session, very insightful, very informative, and super packed. Please don't forget to leave details of your accounts. It's very important. I can bet there are a lot of people here that might be shy to express what they want. I can see the doctor raising up her hand, Dr. Yunus. Go ahead.
Yeah, I just wanted to confirm if the session is being recorded.
Yes, it was recorded also.
Okay.
So now,
Okay. Thank you very much.
Stop. Yeah.
Thank you.
Thank you for the privilege.
All right.
Really.
You're welcome
Bye-bye,
once again. Thanks for the session. Bye bye. Bye everyone. And have a lovely weekend.
Thank you, everyone. Bye.